Hello, I'm Dr. Julie Ronald. I'm the Associate Medical Director for Acute Care with NHS 24, and I'm going to speak to you today about the differences between cold and flu. Firstly, what are the differences? Well, they're both caused by viruses, but what we tend to find is that cold will generally cause much milder symptoms than flu illness. The cold symptoms will generally come on gradually and are usually related predominantly to the nose, the throat. So you may have that sniffly, runny nose, you may sneeze, you may have a sore throat, you may have a bit of a mild cough. We know with the cold it's pretty unusual to get a high temperature, and generally you can carry on with your day-to-day activities. Whereas the flu generally is much more severe. It tends to hit you all of a sudden, and before you know it, you're experiencing problems such as headache, muscle aches, high temperature, general tiredness, and really just a feeling of general exhaustion. You may also get a sore throat, some mild cough, and you'll generally feel pretty icky. How do we stop you from catching a cold or catching the flu? Well, first of all, if you're eligible, please make sure that you do get your flu vaccination. If you are in contact with somebody who has symptoms, make sure that you wash your hands well after any contact with them. And if you have used a tissue for coughs and sneezes, then please make sure that you put it in the bin safely away and don't leave it on any surfaces. If you have come across something on any surfaces, please make sure that you clean those surfaces afterwards. So that being said, some of us will unfortunately end up getting cold or flu. So how do you manage it when you do? The best advice is rest up, make sure you get plenty of sleep and keep yourself well hydrated, so drink lots of fluids. For those body aches and pains and high temperature, you can take regular paracetamol or regular ibuprofen. And we know that colds are generally pretty self-limiting and will only last a few days. The flu can last a bit longer, and it's not unusual for the fever and high temperature to last for several days. If you're going beyond that time period and it's beyond a week and you're still feeling unwell, please make sure that you do seek medical attention. Flu can have some complications associated with it where you can develop other infections such as pneumonia, sinusitis, inflammation of the sinuses, or earache. If you do think you need help, then please make sure you contact your own general practitioner who will be the best person able to give you advice. For managing self-limiting symptoms, please contact your local pharmacist who will be able to help you, particularly around medication supplies. Otherwise, for additional information, please do not hesitate to look at NHS Inform, where there will be up-to-date information. But fingers crossed with this advice, you avoid getting ill over the winter period.